Assalamualaikum warahmatullahi wabarakatuh. We are from Group 8. We present about Perindopril ERBUMINE. We have 3 members, Alias, Bazilah, and Mu'min. This is a drug called Perindopril ERBUMINE. The chemical name is perindopril terbutylamine salt, containing 2-carboxylic acid, a hydrophobic group, and ethyl carboxylic ester attached at one position with a linker group. It is known as a potent ACE inhibitor that used to treat high blood pressure, heart failure, or stable coronary artery disease, usually in the tablet form for oral administration.
Okay, firstly we go to the target selection for the perindopril ERBUMINE. Okay, this drug perindopril ERBUMINE will enter to the body through oral route. Firstly, the perindopril will enter through mouth. Perindopril is known as angiotensin converting enzyme ACE inhibitor. After it enters the mouth, it will go to the liver. The perindopril will metabolize to become perindoprilate. After it becomes perindoprilate, it will enter the body. As I have told before, the perindopril is the ACE inhibitors, so it will blocking the action of ACE. Usually, ACE produces another compound called angiotensin 2. Angiotensin 2 causes blood vessels to constrict and narrow, which increases the blood pressure. So, the function of ACE inhibitors is to block the action of ACE, and then it will decrease the angiotensin 2 concentration and increase the bradykinin concentration. Then it will resulting in blood vessel dilation and thereby lowering blood pressure. So that's why perindopril is function is to lowering the blood pressure. Next, we go to the lead discovery of perindopril ERBUMINE. Okay, first this is hit identification, pharmacophore highlighted, or various indole derivatives. Medicinal chemists are designing various compounds by using the various heterocyclic nucleus with indole against various diseases. Various indole derivatives are available in market preparations, like perindopril, indole known as lead in the synthetic product, which used in the treatment of hypertension. It was patented in 1980 and approved for medical use in 1988. Okay, this is the perindopril ERBUMINE molecular structure. Okay, this is the synthesis process of perindopril ERBUMINE. All of this reaction will happen, and lastly, we can get the perindopril ERBUMINE.
Now, we'll go further with the preclinical developments. In vivo studies, we will use normotensive and hypertensive rats as the animal subject, where if we dose with a 0.03 to 1 or 3 mg per kg of dose, it results to the plasma ACE inhibition, where it shows decrease in pressure response to intravenous angiotensin 1. And in normative rat, plasma ACE was maximally inhibited by perindopril and then returned to the control level 24 hours later, while for hypertensive rat, perindopril showed to be more potent than enalapril, both in terms of intensity and duration of action. And on the hand, human subjects shows multiple oral doses of perindopril confirm the inhibitory effect of plasma ACE, where it results to the significant increase in plasma renal activity. And in vitro studies, perindopril showed to be an inhibitor of ACE both in plasma and tissue. Perindopril exhibits greater inhibition of ACE activity than perindopril and possesses similar inhibitory potency against red plasma converting enzyme.
For the clinical trial conducted by Europa, the European trial. aim, the study examined the long-term effects of perindopril on time to first event of cardiovascular mortality, non-fatal myocardial infarction, or cardiac arrest in patients with stable coronary artery disease. Experimental group 12,280 patients who had evidence of stable coronary artery disease without clinical heart failure. Intervention. After 4 weeks, patients received perindopril 2 mg to 8 mg. They were randomly assigned to perindopril 8 mg once daily or matching placebo. Time frame. The mean follow-up was 4.2 years. The phase is 4. The Europa study showed that perindopril significantly reduced the relative risks for the primary endpoint events. The graph shows beneficial effect of perindopril on the primary outcome is proven after 1 year of treatment. Thank you for watching our video.